Good afternoon and welcome to today's webinar, When the Active Shooter Strikes, presented by Security Management Magazine and sponsored by Johnson Controls. My name is Mike Moran. I am the Learning Content Director with ASIS International, and I'll be your moderator today. Today's presentation will be an hour, including time reserved at the close for questions and answers. We encourage you to submit a question at any time in the Q&A panel. If we do not have time to respond to every question, we will follow up after the presentation. If you hold an ASIS International certification, your attendance today is approved for 1 hour of continuing education towards that recertification. This credit will be applied automatically based on your attendance record for this event. Typical processing time will take as much as 2 months, so if you have an immediate need for the credit, please contact the ASIS Certification Department directly. We are fortunate to have with us today Mr. Richard Serino, former Deputy Administrator of FEMA. The Honorable Richard Serino served as the Federal Emergency Management Agency's 8th Deputy Administrator from 2009 until 2014. From Hurricane Sandy to the Boston Marathon bombings, he has provided leadership on emergency management, emergency medical and homeland security at state, local, and federal and international levels. Richard, I turn it over to you.
Great. Thank you very much, and welcome to this afternoon. Look forward to chatting with you about active shooters, and especially looking at emergency actions that you can take in the planning aspects, especially for security professionals. And the outline today is we're going to very quickly look at what the problem is with active shooter, look at 4 different active shooter response as well as a response to the Boston Marathon bombing, and look at some of the differences between the training and what reality is and how we can bring those together. There's also some new technologies that we can really look at that how it can help reduce risk and improve response, and how we can utilize social media during the crisis and the important role that that plays as we continue to move forward. We'll touch on some policy and planning issues and the importance of really the post-incident response, and a lot of times how that really can make a response that may have been good even to a better response, and how we look at all the survivors, the first responders, as well as the public and people that we work with. And we'll touch on some follow-up solutions. And as mentioned, at the end, we'll have some time for questions, but as you're going through, if you have a question, feel free to submit the question there as well as you're thinking of it. If we can answer it at that point, great. If not, we'll certainly get to it at the end. So as we continue on, the active shooter incidents, as we know, have increased markedly. As you can see in this graph here, between 2001 and 2001, compared to 2014 to 2015, we've seen a marked increase in the number of active shooter incidents. In fact, a lot of the active shooter incidents we find are actually over within the first 5 minutes. 70% of the active shooter incidents are over in the first 5 minutes. And with a lot of the FBI statistics show that between 2014 and 15, we saw 20 active shooting incidents, and that's more than any 2-year average in the past 16 years, and that does not include 2016, and nearly 6 times as many between the period of 2000 and 2001. And that's really where the FBI started to look at these incidents. And 70%, the vast majority of these incidents occur either in a commerce, business situation, or an educational environment. And we're not limited to any one part of the country. In fact, 40 of the 50 states and the District of Columbia have seen these shooting incidents. So it's pretty across the board, across the country. And 60% of these incidents were ended before the police even arrived. And most of the people who were involved in the shooters, the vast majority males, 39 males out of 42 shooters, 39 of those shooters were male. In all of the shooters, all of the 42 shooters during 14 and 15 were either committed suicide, the vast majority, 16 of them committed suicide, 14 were killed by law enforcement, and 12 of the shooters were apprehended. So all of them had a very quick resolution to these. And it's important to realize that as we start to look at the data, how important this is. And we found that 92 people were killed during this period of time and 139 wounded. Again, this is 14 and 15, not including 16. And shootings were the cause of 85% of these were workplace violence in 2015. So this is a problem that we've all seen. We see in the news, and everybody says it can't happen to us. And we'll start to review a few of the different cases. Specifically, we'll look at San Bernardino first. And in San Bernardino on December 2nd, 2015, was when the attack happened. It happened initially around 10:30 in the morning. The person left the meeting, and at 11 o'clock they came back in and started to shoot around. People started hearing popping sounds and crackling outside. Nearly 24 law enforcement it took to take down the suspect and his wife, but that happened separately away from the scene. At the scene of the initial shooting, the first officer arrived on scene within 3 minutes and 32 seconds after the first computer-aided dispatch. But during that period of time, the couple had committed such a brutal attack that ultimately leaving 22 citizens wounding, 14 citizens dead, and eventually 2 police officers were injured later on. It took a while to get all the patients to the hospital. Actually, it took 57 minutes to get all the 22 survivors out of the scene onto the hospital. And then eventually, as happens with some of these, sometimes there's a secondary incident, whether the shooter is taken out at the scene or the shooter leaves the scene. There's usually a second one, whether it's at their apartment, at the vehicles they came in. So to be aware that there's usually more than one scene. Also in San Bernardino, one of the things that the officials did very well was they provide very good, timely, and accurate information to calm the overall community. Because what we're finding is the area that's involved is not just the building, but usually the entire community. And having the responding agencies and developing relationships with the responding agencies ahead of time. One of the key that they mentioned is really building relationships, the leader to leader, organization to organization, and police to community prior to the incident. Having those is really key as to how we're able to develop good relationships ahead of time. Developing good command and control, but having the planning, the response, the training, the equipment, and learn from previous incidents. Learning from lessons learned, as we will do today, and going through these incidents, is a lot of times learning from others and what they did really will help the response as it's going forward. The understanding the importance of taking care of not just the survivors is key, getting them to the hospital as quickly as possible, but the treatment that can be done on site by others as well. And we'll touch on that as we continue to move forward. Another one of the incidents is looking at what happened in Aurora, Colorado. Aurora, Colorado was at the Century Theater shooting that happened on July 20th, 2012. Shortly after midnight, a lone gunman opened fire on the moviegoers at the premiere of a Batman movie. During that period of time, he shot 70 people using a shotgun and an AR-15 semi-automatic rifle and handgun. A total of 82 people suffered physical injuries. That's not including the minor injuries that were not recorded. And again, it'll be a common theme. There are a number of people that are injured with the shooting and additional people that are injured as people leave. Some of the things the strengths that happened during that, again, less than 2 minutes from the first 911 call, multiple units were on site within 3 minutes. And the first fire department arrived within 5 minutes and 30 seconds. They found, again, at a secondary location at the shooter's house, there was an improvised explosive device that took a while but was disarmed. 5 area hospitals gave great care to the victims and the survivors, and police quickly set up a family unification center at the high school. And important part was having that set up quickly where you could identify and treat the families and the survivors with respect. And a lot of the survivors mentioned how important that was. The general public was kept well informed, and some of the issues that came up that we can lessons learned, not being critical, but lessons learned how we can share and learn from them, is it took a while to set up a unified or a single command until late in the first hour of the incident. The sooner that incident command can be set up with folks from the facility, with the local law enforcement, with EMS and fire, and understand where people can go. And for the most critical part of the incident, there was an acting battalion fire chief, didn't have a lot of support of other fire officers because of some isolation. But overall, that went well. They were also separated, and it took a while to get some of the survivors who were injured to some of the ambulances that were parked pretty far away, and we'll touch on that again going forward. And during a risk assessment, the level of risk at a theater was really never discussed prior to looking at the theaters as a possible site. Again, this was a number of years ago and things have changed, but just being aware that looking at sites where people can join together is always a potential site for an incident. One of the more recent ones was in 2016, the Orlando nightclub shooting, with more than 200 rounds were fired from a semi-automatic rifle and a handgun. Some of the Orlando police departments, including some of the SWAT team, responded in less than a minute after the shots were fired once the call was put out. 2 contact teams were put in place, and they were able to get everyone there very quickly. And we mentioned social media. In the nightclub actually put on their Facebook page at 2:09, shortly after the incident, for everyone to get out of the Pulse nightclub and keep running. Found out to be one of the easiest ways to get in contact with people. And that was done by the Pulse nightclub. Most of the survivors were all taken to only one level 1 trauma center, the Orlando Regional Medical Center, so they were getting pretty much overwhelmed. It happened to be just down the street from the incident as well. The perpetrator of this incident, actually about a half hour into it, actually reached out and called 911 to say he was responsible for the shootings and pledged allegiance to ISIS and a number of others, and tried to communicate with him. Some of the clear lessons learned is that there was communications between agencies could have gone much better. There was no direct link between the police and fire, and there was no direct face-to-face. The roading of the civilian injured, a lot of folks ended up going, again, it was fairly close, but ended up going in pickup trucks or other things to the hospital. Again, looking for while the Orlando police followed current best practices to avoid the deaths of hostages, because this was a combination active shooting and hostages, looking at how to deal with these active shooter that turned into hostage incidents, and how perhaps we need to treat these incidents and terrorist hostage attacks a bit differently. We saw some of that in overseas, especially in Paris and other places, that this is a new reality, and we have to look at how we can do that. And some of the tactics and training is something that we'll touch on a little bit later on. But looking at how people are looking at these major sites, be they theaters, schools, churches, as we see large conference rooms and nightclubs, and major sporting events. A lot of those we look at, but now we also have to look at how we can prevent those as well as we're seeing now more and more using vehicles as well. So looking at this as active shooter, but understanding this can be much wider. One of the things that, understanding that these scenes are always very dynamic, but as they start to go forward, we have to also look that as some of these people were trapped inside for 3 hours, as a lot of people tried to escape, that the effect that had on the survivors, on the first responders, but also on the community as well. And Orlando has really reached out to a lot of the community, and how you can do that is an important part of the recovery. The next incident we're going to take a look at is the Orlando shooting at Fort Lauderdale Airport, the shooting there. There was a mass shooting that occurred January 6th in 2017. And again, these last two incidents were not included in the FBI statistics. But a person boarded a Delta Airlines flight in Anchorage bound for Fort Lauderdale. Once he arrived, he went into a bathroom in Terminal 2 at Fort Lauderdale Airport, put his gun together, loaded it, and came back out. He started shooting at random travelers waiting their baggage claim, and there was a deputy that was assigned to secure the upper floor of the terminal, heard the gunshots, and came down on site within less than 2 minutes, was able to come down. The deputies had weapons pointed at the suspect, who surrendered rather quickly. However, there were some of the issues that came up during this is within the initial notification, several thousand personnel heard that this was happening. They all turned on their radios, which ended up overtaxing Broward County's 30-year-old radio system. And the system went into fail-soft or throttling mode, if you will, several times, which cut out or interfered with radio communications. And because nobody was actually sure where or what was going on, and as the word spread, people literally just ran out onto the tarmac, ran out throughout the various areas. In fact, one of the fleeing survivors, somebody who wasn't injured, attempted to seek shelter near the rear of a marked car. It turned out to be a K9 car, and somebody got injured there as well. And there are actually more people injured in the evacuation than were injured in the shooting itself. Obviously, some more severe with the shooting, but a large number of people were injured. There was also a lot of miscommunications and wrong information about an unconfirmed report of another gunshot victim in a second terminal. And again, radio interruptions and misinformation, anxiety among the airport employees triggered a lot of misinformation that happened rather quickly. On top of that, a fire alarm was activated, which automatically opened all the doors leading out to the tarmacs, and again, more people rushing out onto the tarmacs. So a lot of issues that can happen in an airport, and we'll, again, address some of these solutions going forward. But some of the strengths that came out of this one is the first responders and the airport personnel responded rapidly to control a lot of situations. But as they were trying to do this, again, people were going many different locations. The unified command post was set up. It took a while to get everybody that was needed there. Some of the airport people, as far as flights were concerned, took a bit longer to let the incident commander be aware there were planes sitting on the runway for long periods of time. And realizing that there's active shooter incident is not just one incident. It affects many different things around there. There were people left on planes for hours and hours that couldn't go, and the incident commander was not made aware of that initially. So lots of different, as I say, many of these are more than one incident. There are many different incidents that are rolled into one. So as we touched on each of these incidents, we're going to look at some of the planning and the response, emergency response and planning, and look at some of the policies. And there was an incident that happened at JFK Airport where there were false reports of gunfire, and people started running, going out through security doors, onto the tarmac. And that shows that you really need to look at the access. You really need to look at why are people going out onto the runway when they're in tarmac when there is nothing that actually happened. Because people are so nervous that having good information, quick information, is absolutely essential. And also addressing how people can gain access or egress from an area to an area. Define clearly routes where people can go. Look for areas that may be locked down, that you do want locked down, or you want to have open. You have to look at each one of these individually into your facility and try to predetermine as many as that you could have as access and egress and access for first responders as well. One of the keys is having staff in facilities very familiar with what external responders and train with them what they're going to do when they arrive on scene. realizing each incident is different, but understanding that bringing people together, first responders, to your facility ahead of time really makes a big difference. And first responders, emergency responders, a lot of people have been used to, especially in hazardous materials, many incidents that we've responded to over the years, is to look at the traditional hot, warm, cold zones and how they work. And what we found is that on a lot of active shooter incidents, after the shootings many years ago at Columbine, law enforcement changed the way they respond into incidents. However, what we found is fire, EMS, we didn't change how to respond to a lot of these incidents. That took much longer until the last couple of years to look at how getting people out of the scene safely and quickly, that perhaps looking at the military model is to allow for a rapid response, which law enforcement is doing, but also fire EMS and how EMS can play a role initially in people being taken care of. After the gunman, as we heard, 70% of the time is over within 5 minutes. How can the law enforcement, once the person is neutralized, but at the same time reach out to start treating people, not the initial officers, but a little bit later, whether it's direct pressure or using tourniquets. Hemorrhage control for law enforcement personnel, training them with tourniquets and quick clotting and bandages has made a huge difference, not just in active shooters, but in day-to-day incidents in cities that have implemented this early on, has ended up saving lots of civilians as well as other police officers as we were able to do this. And looking at how you can increase somebody's the survivability with life-threatening hemorrhage if you empower the first responders, specifically law enforcement, and train them how to use tourniquets, has made a huge difference in the survivability. But also we found that the public involvement in many of these incidents has really increased. That yes, most people are going to run away, and whether it's run, hide, fight, or whatever, people to go away, and we want people to do that to keep safe. However, once the scene's safe, our people are behind to make the difference that we found. The real first responders are the bystanders who can provide direct pressure to wounds, can save lives. We saw this in the Boston Marathon bombing, that civilians stopped, helped with tourniquets, provided direct pressure, and saved lives. Having the public of how they can make a difference in educating the public in numerous communities around the country, and a few corporations have looked at how people, individuals, can make a difference in how they can save somebody's life by simple direct pressure. The statistics and the information out of extremity wounds in Iraq and Afghanistan saw large numbers of lives saved by simple things we can do. And how can we translate what happened in the military to civilian life? And there's a number of groups that are working on this and how we're able to look at doing this in the future. So I think if we can look at how we can have more people take care of people, the people on scene to start treating people. As we looked at a number of these incidents, these 4 incidents, and a number of others, there seemed to be a consistency, and one is not an uncommon one. People say communications. But I want to be clear that, it's not necessarily radio to radio. There's technical solutions to that. It's actually the face-to-face, and it's people able to talk to each other. Having the communication, the ability for equipment to talk to each other, a lot of that has been done. Some needs to be upgraded, but a lot of that has been done. But we really have to find ways for agencies to actually have face-to-face, talk to each other, for the ability of how the people can continue to work together. Continuing training ahead of time, obviously, but maintaining that control of the scene. Having, obviously, people leave the scene, but if people are actually treating people, taking care of people, and putting tourniquets on, a direct pressure can really save somebody's life. And realizing that maybe not everybody has to leave the scene. You want to make the scene secure, remove people as quickly as possible. And look at, in this new society, how we have to deal with these terrorist attacks and hostage situations, as we mentioned specifically in Orlando. and how to develop protocols both internally within your own facilities, but also how to make sure that you don't do that in a vacuum. You don't do that in your own silo. You have to reach out to people, reach out to the local law enforcement, to the local EMS agencies, to the local fire agencies, and the emergency managers that are have the ability to bring those all together. And as we start to look at training and realizing the importance that training matters in these incidents, during the Boston Marathon bombing, it was no accident that 262 people who were injured survived the attack. It was no accident that all the people who were injured survived that scene and all removed it within 22 minutes. It was no accident that people were evenly distributed to hospitals. It was no accident that there were tourniquets on scene. It was no accident that people had trained specifically for this type of incident. It was no accident that the Medical Intelligence Center was open. It was no accident that police and EMS had worked together drilling this incident many times. Almost a very similar incident was drilled a number of years ago. And one of the things that we learned from the Boston Marathon, many things, but one is that one thing we did not plan for was the kindness of strangers. Whether it was the strangers that helped out immediately to put on tourniquets, to provide direct pressure, or was the kindness of strangers right after the attack opening up their facilities, whether it was the kindness of strangers helping out the first responders throughout the week. And I think one thing that's necessary is we need to plan both internally, externally, of how people are going to come and help. And you have to plan for how you're going to deal with that. Some people want to keep them all out. Some people want to if people are helping right away, let them stay. But you have to be able to plan for that. One of the factors that contributed to the high survival rate within the Boston Marathon was the location happened right near the medical tent, happened near where a lot of people were, but it also was an action of the bystanders, the pre-hospital providers, EMS system that was in place for many years, and also planning for an MCI very similar to this. The MEMA, the Massachusetts Emergency Management Agency, other communities have really developed to enhance these responsibilities. A number of exercises that both Boston Police, Boston EMS, Boston Fire, all planned and trained together for many of these. And we looked at Boston Marathon, the 4th of July, first night, New Year's Eve in Boston, as a special event, as a planned disaster. And looking at some of the lessons learned and sharing the information, how we're able to share between all the different agencies, whether in having detailed, scalable maps for specific events or specific facilities that help facilitate dispatch for the responding police, EMS, or fire, so they understand the zones where they can go to. And as I mentioned, having these large events to train, test emergency plans, look at these as mini MCIs, train for as if a mass casualty will happen, some real events that people are used to having. Some of the issues, other lessons learned from the marathon was that as the event went on later in the week, that law enforcement from all over New England came in, and thousands of law enforcement arrived on scene, similar to what we heard in some of the other incidents, developing protocols in place for other surrounding departments. Fire departments usually have a very good mutual aid system, but how can that be implemented within law enforcement? Or if people are coming to your facility, understanding that. Also, one issue came up is identifying the survivors, people who were injured, and some of the fatalities. That was very important to try and do that early on. And these events, most people, as I mentioned, they may be over quickly, the initial shooter, but the effects can go on for days, as whether apartments that people are at, their buildings, and the survivors, and getting people rest. People are very good about their staff, 12 on and 12 off during incidents, because you never know how long these go on. However, taking care of folks, specifically the leadership, the command staffs, the leadership of the buildings, making sure that they have time off as well is essential. And as we start to look at EMS trained response versus on-scene response, we see here the average response time in urban areas is about 8 minutes, sometimes in rural area 13 minutes, sometimes it's better than that. We heard on some shootings it's better, but this is an average EMS response time, which is why we mentioned about the Stop the Bleed campaign, people, what they can do to control bleeding early on. Very simple thing that there's the professionals, there's the first responders, but the immediate responders are people that can truly make a difference if they can simply stop the bleeding and control bleeding will save lives. A number of the campaigns that have been a combination of what the White House has done, Department of Homeland Security, that have been brought together, a number of physician groups, to have shown that this very simple strategy works. Apply simple direct pressure with your hands if you have a dressing or a towel, add direct pressure, and if necessary, to apply tourniquets. And as we start to educate people and put in tourniquets, some places, Charlotte Airport and others, they have an AED, a defibrillator, but in that same compartment, they have tourniquets as well. So help building a national resilience, how we can better prepare the public to save lives, not just in active shooters, but day-to-day incidents matters as well. So looking at public buildings, looking at businesses, schools, airports, places that we can continue to educate people of how they can stop the bleeding, how they can save lives. A group of physicians from all across government, all across the private sector, leading trauma surgeons, led by Dr. Lenworth Jacobs. He was a leader in trauma surgery and a trauma surgeon, got together a number of folks to look at some of the classic principles of innovation and inclusion, of how to bring together a world-class team of government, health leaders, people from the White House, National Security Council, DHS, FBI, FEMA, local, and created a document called the Hartford Consensus Document that people haven't read. It's very simple. You should, because it gives simple things that you can do, simple tools that both first responders as well as the general public. The first one, in using the acronym THREAT. Threat suppression, hemorrhage control, stop the bleeding, get the person that's injured out of there as quickly as possible, assessment by medical providers, EMS, and very quick transportation to definitive care. Understanding taking care of the threat first, but following these simple tools will help increase survivability in a lot of the mass shooting and other trauma incidents. But what we found is that when tragedy strikes anywhere in the nation, the willingness, the capability of everyday citizens to act instead of being passive bystanders truly means the difference between life and death. Having first responders utilize tourniquets, having the public help take care of people really matters. Simple things that people can do to save lives. But as we start to look at technology that can be utilized as we start to move forward, looking at having good communications in the middle of a crisis, how we're able to create actionable messages which include a very clear understanding of threat, what people can do to protect themselves, and how and who to contact for help. Having a good notification that people can get that information very clearly. And this is something that you can set up ahead of time. You may want to change a few words, but very clearly, short information that you can either send out by text, overhead page, or whatever notification system that you have. And being that calm in a storm. During the Boston Marathon bombing, because of training that had happened with the folks at Boston Properties and Alan Snow and a number of people had drilled similar incidents for years, didn't have direct communications with law enforcement and public safety for the first few minutes, but they knew what to do. They had planned for it. They had worked with people. So, again, actionable messages, clear understanding, calm, what they do, how they can pass that information on. Giving that real-time information and instructions to people in the building, because they are going to hear, whether they're turning on the news, they're following, they're going to go to Twitter, they're going to go to Facebook, they're going to get a lot of information. So you have to be authorized, quick source with good information, preferably, again, having visible signals, text and graphics that you have ahead of time that people are used to seeing. There's also technology that can help ID where individuals are located. Having a database of people that are in the building with their phone numbers, names, emails, obviously cell phone numbers, so you can send information to them because people probably will not be sitting at their desk. People will be moving around and moving around quickly. Having a good video management system for video surveillance, active monitoring, passive monitoring, looking at what people can actually see. Having that information, there's video analytics that you can look at, getting detection, tag information. You can get a lot of information from video, but they must work in conjunction with other access control systems that can begin initially when information should happen that ties into the video monitoring, will tie into the messaging that you want to be able to send out. As you also, some very new technologies is looking at gunshot detection. This is proven technology, DHS, Safety Act certification has been, there's other testing verification that can actually pinpoint a shooter's position within seconds, determine whether it actually was a shot fired or something else that was fired, that something else made that noise. It has been tested in military venues for years and proven a great technology that can identify where the shooter is, can then play back video, as mentioned previously, have video, can direct directly to the video source, direct the cameras to that, and then have a playback of 5, 10 seconds, whatever you need, that will instantaneously come up to whoever's watching that. So a lot of that can really help initially to determine where this is from and is it real or not real. And that's essential that you'll be able to get a lot of information to the team on the ground, to the people in the building, public workers, to let them know where to go, what to do, and how you can get more information. Lots of new technology can and will help save lives. Mentioned social media and how social media plays a key role in attacks and how we're able to look at social media and how people in, whether it was in Fort Lauderdale, whether it was in Orlando, the Boston Marathon, people go to social media right away and how they look at that. And there are some challenges. People aren't familiar with it. People think you have to be trained. There's a lot of expense in looking at various technologies. But I think one of the things that's important is that people are using social media more than ever before, and it's something that we have to really look at. It can be a great tool that can help with geolocations, where people are, how we're able to get information to them. I've heard for years that people worried about social media gaming the system. In the initial incidence of a response, that's actually very rare. But you want to be able to understand that people may send information, they may represent the events. However, if you are getting lots of information from multiple sources that are geolocated, sending video, it's understanding that having a good social media system is absolutely essential. In Australia, they actually have social media intelligence analysts. A number of cities and states around the country do as well, looking at social media, analyzing that, understanding what information that you need and can gather from social media, but realizing it's also a two-way street and that we have to look at how important that social media is and the role that it's going to play specifically during a crisis. Also looking at how best practices during Sandy, FEMA, we used it a lot to get information, but also to realize what people were saying. There are a lot of rumors out there, misinformation, having FEMA saying those, but also having other partners and agencies actually look at those and say that we need to have other people give good information out there as well. In the Boston Marathon, and one of the first times that law enforcement used it, it actually turned out to be the #1 place that people went to for good information, and having somebody that's used to dealing with public information dealing with social media. You don't want to have somebody in your agency or whoever using social media for the first time You have to be active on social media. You have to establish a presence. You will see an increase in social media during an incident, but you have to be a trusted source ahead of time. The Red Cross has had a good system for years, identifying needs, getting information out, and sharing information as well. And as we start to look at a number of opportunities that with social media, but also how to work and share information among different multi-agencies, and utilizing social media can and should be a part of that, and also how they can work with different fusion centers that are around throughout the country in many locations. And having support from the federal partners is able to deploy personnel, able to bring training and technical expertise. FEMA has a program called JACTOS, Joint Counterintelligence Awareness Training, that initially was a one-day for law enforcement, but then has expanded quite a bit for a second day to include the EMS and fire response. In bringing together the private sector partner to these trainings is very important. And how people can share information, sharing the information and having that interoperability, looking at how the fusion centers that are all over the country, how to develop those networks, and understanding that it's not just law enforcement. If you see something, say something, but also say it where. Understanding that people within the communities need to be part of a team, and how they can pass on that information and what they're able to do and how they're actually able to do that. Having the National Information Exchange Model gives a common understanding of how people are able to work together and continue to develop policies, protocols, and to develop the relationships well ahead of an incident. After an incident, one of the things is to look at, I worked with the National Academy of Science and Medicine, and looking at a number of different issues of how people can work together. And a lot of times we do a lot of planning for response, but we don't plan for recovery. And looking how government, specifically businesses, healthcare, and look at how we can prepare for recovery, because effective recovery that brings people together ahead of time is going to help the community and the businesses respond and take care of the survivors much better, and deal with the victims and the victims' families after an incident. Realizing the mental health illnesses, it's not just the survivors that are going to have issues, and it's not just the first responders. It's actually bringing together the community as well, and the impact that this had on the community. Boston Strong was something that really made a difference and helped people recover within the city. Having the One Fund that people could be part of a solution. Having a lot of mental health needs that companies provided, but also the city's EMS and the city's public health provided long-term mental health support that really went into years. The One World Boston is a group that was formed out of Marathon that literally has gone all over the world to help survivors after an incident. There are a number of groups that people should find and be aware of how to reach out to. Having a hot wash immediately after the event is essential. And, after action reports sometimes take a while and they're great, but having a hot wash immediately to identify what didn't go well and have somebody document those. After action reports take a while, sometimes they get filtered, etc. But the hot wash is usually where you get some very good information. And understanding the physical scene. Should the scene be cleared initially? Should memorials be set up? And that's something that has to be decided almost on an individual basis. So a lot of information says clear the scene, but people need a memorial for a little while afterwards for them to connect, to do things. And then at the appropriate time, and there is no set dates, there is no set number of days, to actually move that to somewhere else. That after the marathon, after a couple of months, moved it literally next door inside the library as a long living memorial for folks. But realizing that the broader community, the nonprofits, the faith-based community, government, but importantly as businesses as well, really have to support how people can help recover, whether it's hotlines, counseling services, that includes in hospitals, giving people self-help tips, educational materials, following up with people. Found in almost every one of these incidents, the long-term effects actually have a much broader long-term impact than we initially thought on a lot of these incidents. So understanding that and taking the opportunity to deal with those is really an important aspect as we plan for recovery. I mentioned the hot wash, but also the after action is bring to people all different groups of people from many different areas, looking obviously overview the goals and objectives, but bringing together, make sure the right people that you're talking to, not just the leadership, talking to the people that were in the trenches, talking to people that actually dealt with it, and getting their feedback. And then not just that everything went great, but things that didn't go well, and sharing those with others, because that's how we're going to learn to help prevent incidents in the future and to save more lives. Understanding that, what happened, what was supposed to happen, what really happened, and then what we're going to be able to learn from that. It really builds that trust across an organization when people are honest and able to do that. How we're able to improve and how we're able to improve as one. And I think that that's one thing that's really important, that we have to look at this on a much broader level, not just an individual. There's no one agency, no one city, no one state that's going to be able to handle a lot of these incidents going forward. Sometimes in after-action reviews, you also have the ability to actually spark a lot of creativity. You're able to give, sometimes some of your best solutions are going to come maybe from your new employees, or maybe somebody from the outside that you trust, to give a fresh set of eyes. Hopefully you can do this not just after a major incident, but also, as I mentioned earlier, look at these special events as planned disasters, and then have an after-action review on that of how you're able to kind of, that help to make the call go better and enable the decision-making that you're going to be able to do that, and be very clear with your message so people are not necessarily going to misinterpret the message as you go forward. And one of the quotes from Dr. Kelly Victory is, the fact that they trained together, they trained for it, fire, EMS, law enforcement, the hospitals, they all had coordinated, done trainings before that, and they knew each other. There's a great familiarity. Knowing people, as we've said, some of us have said for 20 years or more, you don't want to exchange business cards at the scene of a disaster. Well, actually, you want to actually develop a real relationship with people long before that, so you're able to have a good relationship, so you're a trusting relationship with people, so you're not meeting somebody for the first time on game day. Craig Fugate, the former administrator at FEMA, I worked with Craig for years. The emergency manager is like a football coach. He goes, you get out there, you train everybody to do the plays, you make sure they know what's going on, and the day's event happens, you're going to make sure they know how to do it, and you're going to be on the sidelines coaching them along. So you want to practice with people ahead of time. You want to give them the tools to do the job, so that during when an event happens, that you're all working together and that you won't have a lot of surprises. Developing solutions, again, touching on having wellness programs to assist in the psychological recovery, having whether a staff psychologist or a peer support team is important. If you don't have one, reaching out. If your business doesn't have one, peer support teams in most cities at EMS and fire and police departments have those. Realizing that the first responders is also going to affect their families. Understanding that. Co-workers that you work with, it's affecting them and their families, and understanding that. And when court cases come up years later, that does bring up a lot to first responders. Trust me, I've been there, done that, I know. That events will trigger other events as well. So having support for people is absolutely key, in realizing that just because the incident's over doesn't mean that it's over. It has a long way to go. And before I go to questions, just a quote from Dr. Lenny Marcus. He's the director of the National Preparedness Leadership Initiative here at Harvard. And effective emergency preparedness and response requires leadership that accomplish perceptive coordination and communication amongst diverse agencies and sectors. Nevertheless, operating within a specific scope of authority, preparedness leaders in characteristic bureaucratic fashion often serve to bolster profile and import their own organization, thereby creating a silo effect that can interfere with effective system-wide planning and response. So in other words, we can't operate in our own silos. We have to, or cylinders of excellence as some have called it, we have to look at how we can work across the different silos, how we're able to work up and down, but how we're able to lead across and beyond. And that is going to help save lives during the crucial minutes after an incident. So at this point, willing to take questions, and if there are questions, we'll go to them.
Yeah, hi,
we
Rich.
Have a number of
this
questions.
is Mike again. Yeah, thanks a lot. We've got a lot of questions coming in. Folks, if I could encourage you all to enter your questions now as well. This is regularly one of the high-value portions of the presentation for the audience. So without any further ado, let's get right to our first question, Rich. Are there grant programs to help facilitate the equipping of a facility with the gunshot detection program?
I know there are a number of grants that are available to cities and states that people can utilize to do that. For individual private facilities, I'm actually not sure. The vast majority of grants that come out go out to the cities and states. There's also port security grants, and then the local jurisdiction then decides where they can go from there.
Next question. What are your thoughts on table to exercises? How far do you take them?
Well, I think for the tabletop and the full-scale exercises are very important to do, and I believe you should push the point to failure. If you do an exercise and everybody says, oh, we did a great job, then it wasn't a good exercise. You really need to push folks to challenge them. You need to make it as realistic as possible, and you have to practice and train, because that's how you're going to respond. One of the things that, people talk about, I mentioned briefly earlier about how, commanders will, stay there forever, 24, 48, 72 hours or longer. In the middle of a drill early on, if you have 2 hours, say the first hour, okay, now that you say it's fast-forwarded 12 hours, bring in new leadership to learn, to get people used to doing that. Pushing people, understanding that people will have what people are going to do in an active shooter incident, understanding how staff is going to respond, but be very, very clear, obviously, telling people this is a drill, making clear it's a drill, educating people not the day of, way ahead of time, that the drill's going to be happening, to prepare them for that, because it is stressful on people, but understanding that, going through a series of education first, then a tabletop, before you go to a full-scale exercise is key.
Richard, what are some of the factors that the folks should consider in terms of the frequency of exercising they're doing? Are there factors such as employee turnover, or what should help them schedule these things?
Well, I think one of the things you have to look at is the type of business. If you're in an operation that goes 7 days a week, 24/7, such as an airport or a hospital or a manufacturing plant or somebody who works 24/7, people say, well, we held a drill. Well, that's great. You held a drill on whether it's daytime, evening, or nighttime, that you got maybe, if you were lucky, 25% of your employees. So understanding where you're at and having drills, multiple drills on all shifts, and then having the drill so all the employees get to attend. Quite often people will do a drill and says, oh, we're done, we did it, but how many employees really participated in the drill? So I think that's the first step, is making sure that you have you're able to reach a large number of the employees, but also follow that up with having these on a regular basis. People remember for years we had fire drills on a regular basis, and it's similar. But don't just do the drill first, do the education, do a tabletop drill, and then follow up with a larger drill. And having those at least on an annual basis is important. Because there is, in most businesses now, there is a lot of turnover, and if there isn't turnover, getting people used to that. And if you do this in the three-step process of education, followed by a tabletop drill, followed by a full-scale exercise, and it doesn't have to be, bringing in everybody, but bringing in certainly, the local law enforcement, local EMS, so people are familiar with the facility, actually very early on in that process. And if you do those once a year, you're actually touching people 3 times a year on a regular basis.
Makes sense. Okay, our next question. I've been hearing more often that run, hide, fight are the proper steps, but maybe not in that order, that people are stronger in groups, and that a fight first could have helped subdue the shooting in Orlando sooner. What are your thoughts on the run, hide, fight order?
Well, I think run, hide, fight is a good solution to the problem. And similarly, if you're on a plane, there's nowhere to run, and we found that, as we've seen time and time again, having the ability to fight makes a difference. So again, you have to look at where you're at. Unfortunately, fighting at Sandy Hook probably wouldn't have made a difference. So understanding where you're at, understanding what you're doing, and it doesn't say you have to run all the time and then fight, and then hide and then fight. It doesn't make sense to run. There's nowhere to hide, so we're going to fight. It doesn't have to be, we're going to always run. It's things you can go through in literally seconds to do those.
Okay. Next question. In the K-12 education space, what type of policy do you recommend when young children are involved? Is having locks on doors enough?
I think, especially with K through 12, especially even younger ages, this is where at the local level, reaching out to your local law enforcement, emergency manager, EMS, and fire in developing the situations that's best for your school. In the community I live in, we have some schools that are over 100 years old, and we have some new schools that are less than a year old with high-tech solutions. The same response is not going to work in both of those settings. So understanding the physical facility that you have, understanding if you brand new school, high-tech options with cameras, automatic door locks, you can control doors here and there, you can lock them, you can shut down, open and close, versus the 100-year-old school that, a lot of classroom doors don't even have locks on them. So I think, you have to really look at the individual schools, bring in the local law enforcement. There's a lot of information that DHS has on how you can do that and how you can reach out to look at that. But saying that, this is how it should be in every school, just in my community, I know there are very extremes that you have to look at the individual school.
Good. Richard, the clock is our enemy, and we're close to the top of the hour, but I think we can get one more in. And I'd like you to address this one. We currently have a mass notification system, but currently use it for both emergency and business messages, such as employee benefits, enrollment reminders, and company events. How do I make sure my staff can easily distinguish a true emergency from a drill or non-emergency communication so that it's not just ignored?
Well, I think we all get saturated with routine text. There's actually ways that you can, highlight that this is, if you have great technology that can make your phone, and this exists where your phone can flash and make noises similar to when you get an iPause announcement or the Amber Alert notifications that wake us all up at 3 in the morning on a severe weather. And having that ability to go the difference between routine notifications versus a real emergency. Also having people, have bold letters or block letters or however you want to do that, that people get used to the difference right away. So there's technology that can help, and if you don't have that technology, also making it clear that you want to send this message out to this. There's a few different kinds of software that can really help in doing this and can notify people in specific parts of a facility or in certain parts of a neighborhood or wherever. But having that information so people get used to the that this is an emergency, and don't abuse it. Have drills. Don't send out on this emergency notification that you used to that there's a bake sale today on the 4th floor. And really being disciplined about that.
Okay. Rich, ladies and gentlemen, that is all the time we have for today's presentation. I'd like to thank you for attending today's security management webinar. I'd also like to thank our sponsor, Johnson Controls, for making this event possible, and especially to Richard Serino for sharing his expertise. For ASIS and Security Management Magazine, I'm Mike Moran. Have a great day.